Well, I'm delighted to be in Sydney, Australia at this very important conference. I'm even more delighted to be able to give the keynote address today. My discussion's been on clinical quality, and I've looked at global systems and comparisons between some of our developed countries and Australia. And whilst in many respects Australian healthcare, its standards and quality are very high, of course every country's got something to teach and something to learn. So I've basically been presenting today about some of the insights that we've gathered over the last 4 or 5 years in looking at sustainable healthcare and how you improve quality. And it seems to me that the big message that I've been giving over the last day or so is that clinicians are obviously accountable and responsible for clinical quality, and it's important that any health system holds those clinicians to account. It's also important that patients are able to feel empowered to have greater say in their healthcare, and it's also very important that a confident and high-performing health system is transparent and honest. And what do I mean by that? I mean that outcomes and clinical outcomes should be published more routinely so that health systems and health professionals can look at their performance relative to others and say, right, that's not good enough, or we can do better. So in a sense, I'm also saying that the culture of a high-performing health system is a great mix of both anxiety and also curiosity. And what we've found in our global work, our global travels, is that the best organisations, like the best clinicians, are never too complacent and resting on their laurels, but always looking to do more, restless if you like, to do even better all the time. And the work that we've been doing suggests that where you do empower and involve patients and their carers, not only do you get better quality outcomes, not only do you get higher patient satisfaction, but also there's a good international evidence base now to suggest that costs are between 8 and 21% less. And if you think about it, the more you get patients involved in design and co-production, they feel more confident in actually managing their own care. And given that there's been an explosion of long-term conditions across the developed world, these conditions have to be managed by the patients and then their carers themselves. So that's why I say that patients should become more empowered in their healthcare. It makes great quality sense. It also makes great economic sense.